Right, so Rebecca, we're all suited and booted in our uniforms today.
We are.
So we're here because we're having our network event meeting with all the nurses. So you had a chance to meet some people that you've only ever seen in a little square box on the TV screen. So how are you finding it?
Yeah, I mean, it's just been absolutely fantastic. I mean, considering with the pandemic and everything that's been going on, although we have our monthly network meetings, being able to see all the nurses online, there's nothing quite like it when you're in a room together, face to face. You know, you can really get to know each other on a personal level. And just even this morning, the education has been phenomenal.
It's been a really
amazing.
It's almost a shame we've kept it a secret in-house, I think. And I was saying to the team that maybe it's something so we can reach out to people that won't necessarily work with us but have got interest in these things as well.
Yeah, I mean, all these sort of special interest groups. I mean, the light chain sclerosis was absolutely fascinating, and I just feel like as a practitioner I'm constantly learning more and more and more. And then obviously, you know, bringing in the fold of aesthetics, you know, into the women's health clinic, you know, is just amazing. You know, women ask all the time when they come into clinic, you know, can you sort out a scar or a tissue damage or a mole or a skin tag or a rejuvenation, and it'll just be wonderful to be able to offer those services.
Well, I think also patients have a real, they feel safe with us. So even if they are going somewhere else, they actually want to keep that communication with us because of the relationship we build with them as well.
Yeah, well, that's it. I mean, we have time to give to women. I mean, a lot of the women that are walking through the doors can be really distressed, really like they felt that they haven't been heard or listened to in other facilities of healthcare. And, you know, they come to us and, you know, we're there, empathetic, sympathetic to their needs, listening to what their real concerns are. And, you know, and they feel safe. And as you say, it's like a safe environment, women nurse-led.
Yeah.
I mean, and it's where women want to be. And, you know, they immediately relax their shoulders and they thank you afterwards for just listening to them. That isn't even before we've even spoken about a treatment plan or a management plan. It's just being heard.
Yeah, and that's probably the most valuable part, I think, isn't it?
Yeah.
And obviously since we last spoke, we were doing training, weren't we? So how are you getting on with the training? Are you feeling a bit... We've had an interesting day, didn't we?
So we had a fantastic day. I was very fascinated by lots of sort of either beautification or, you know, repairing scars and injuries that have happened through operations. So I thought that training day was remarkable, and I was really hoping to see some post pictures a few weeks later to see what the difference has been as well. But having seen the lady with the mesotherapy treatment, I mean, wow, her skin is flawless. And, you know, and I did feel a little bit nervous after having done the mesotherapy on her skin, thinking, gosh, I've scratched her whole skin. But actually, you know, a few days, couple of weeks later, you know, this beautiful, you know, complexion, flawless skin, and boosts that person's confidence.
That's what she said, didn't she, in the text she sent? So she'll be, those two ladies, the lady who did the peel and the mesotherapy, are going to be doing a blog for us. So they're going through the course of treatment. So that's really quite exciting as well.
Yeah.
And obviously you'll be able to carry those treatments out at... so you've predominantly based at West Byfleet, but you've also helping to cover out at Canary Wharf and Harley Street as well. So we can really get that out. Oh, and Brighton. Forgot, you're helping out at Brighton now.
Yes, so I've got my Bible, all my protocols, learning them off by heart. Obviously, I'm familiar with it and had a lot of training around it. So it's just really, you know, getting that underway and just really listening to what women want and what they need, and, you know, potentially be able to offer scope of, you know, what can be done or what is available. So yeah, it's really exciting. I'm excited about this afternoon with the yoga lady and the sort of psychotherapy and emotional you know, health and, you know, physical health as well, of what we can do, you know, without treatments, just what we can do in our own home and on a daily practice.
We've not even started on the skincare.
No.
Brilliant, thank you. I shall let you finish your lunch.